Emily is a 33-year-old female western lowland gorilla that lives here at the Oklahoma City Zoo in our Great Escape exhibit. Back in 2010, we had actually done an examination on Emily and discovered that she had an umbilical hernia. So that was something that we really wanted to keep an eye on. And we did that for several years. It did not change. It wasn't causing her any health issues. And thankfully, being a very smart animal and a very tractable animal, she was trained through operant conditioning to present her belly for the keepers. And we were actually able to ultrasound that on a monthly basis to make sure that there weren't any changes. Earlier this year in 2018, we noticed a slight change in the appearance of the hernia, where it looked like possibly some of her intestinal tract was becoming involved. And so we really decided at that point that maybe surgery was the best option for her so that she did not develop any sort of life-threatening condition. The best option for Emily was determined to be a robot-assisted surgical repair. So that's where you have actually a robot machine that comes in, and through very small incisions in the abdomen, you're able to actually do that repair. And it really is just very minimally invasive. There is no big incision afterwards, and healing time is drastically reduced. And what we did was, starting off, got her all set up and scrubbed and sterilized for surgery. There literally was just 3 small puncture holes into her abdomen in which little metal ports were implanted so that little instruments could go in and do all of the surgical work on the inside. And there was a robot unit that came in, and that is actually what performed the surgery, with the surgeon at a console unit controlling the different arms. And then we were able to remove all of the fat and tissue that was stuck in the hernia hole so that we could actually see the defect. And then the defect was closed with primary suture. And then once the defect was closed, a mesh product was actually sutured around that as well to further stabilize the repair. And we do think that this is the first robot-assisted surgery that has been performed in a western lowland gorilla. Thankfully, the surgery went fantastic. It was perfect. We had a great repair, no complications. So what Emily is doing right now, she's actually resting. She's away from her family group, but she can see them at all times during the day. She's doing fantastic. She does not seem to have any pain or discomfort. The repair is doing very well. Really, doing the robot-assisted surgery gave her the best possible chance for a full recovery with no complications.